Well, we've got WWL Louisiana Chief Medical Correspondent Dr. Corey Hebert joining us this morning with some top medical headlines. Talking about this first one was scary for me to read. We're talking about some common drugs like Benadryl and others linked to dementia.
Right. So people that are out there right now listening to this report used Benadryl to go to sleep last night. So many of you did. Now that's not just Benadryl. That is Advil PM, Tylenol PM. The drug is diphenhydramine. That is Benadryl. And so many of us use this to go to sleep. Well, we have known for a very long time that these drugs are not something you should be using all the time, right? Just something episodic you should use. But now we have a lot of data that shows us that if you use these medications, especially every night for multiple years, you have an increased risk of dementia. Now, one of the studies actually showed that if you are over the age of 65 and you use this for about 10 to 15 years, then that increases it all the way to 65% increased risk of dementia. Now, when we start talking about these things, we need things sometimes to go to sleep, right? We recognize that. But the reality is that you need to be using something different to go to sleep. And most people don't realize that if they're using Advil PM, all that is Motrin with Benadryl in it. Or if you use Tylenol PM, that is Tylenol with Benadryl in it, right? And some of these over-the-counter sleep medications are just Benadryl themselves, but they don't call it Benadryl. They call it something like just sleep if you have a sleep ailment and things like that. So basically what we need to remember is that we don't need to be using these medications every day for sleep. All right, that's the biggest thing that we want to talk about today, because right now people are, we have so much anxiety about people in our family getting dementia and Alzheimer's and these kind of things. So we need to do what we can do earlier so that we don't get these types of things, right? The next thing we really want to talk about is when we start talking about this drug, well, actually, people think of it as a drug, but it is a sweetener called Splenda, also known as sucralose, right? Splenda is something that we use. It's 600 times sweeter than regular table sugar, all right, 600 times sweeter. But in 2023, the World Health Organization came out to say that it causes all types of issues: metabolic dysfunction, cancer, diabetes, weight gain, cardiovascular diseases. We know all that. But a study very recently just came out to say that it doesn't even change the way that you decrease your hunger. What does that mean? That means that you're taking a sugar sweetener so that you don't eat so much sugar, but what it's doing is actually making you hungrier, right? So not only is it hurting you as far as your health, but it's not doing what you want it to do. All right, it disrupts your hypothalamus in your brain, which makes you hungrier, folks. So please, we need to decrease the sucralose, which is Splenda. Decrease the Splenda, if not, just take it away 100%. And then remember that the way that you need to lose weight is to decrease the calories. I know that's hard to do, but please do it just for your overall health, right? So what do we have today? No Tylenol PM, no Advil PM, no diphenhydramine, Benadryl containing products for your sleep, and decrease or get rid of all of your sucralose.
Yeah, and that's scary too when you're thinking every time you sit down like at a diner or something, that's like sitting on the table right in front of you. So
you got yellow, you got blue, you got pink. Pick one.
You don't want any of them.
No,
okay.
exactly.
And then finally, you want to talk about one more thing. We have about a minute left.
I just want to throw this out there. A lot of times when you are having a medical illness, you want to get a particular medication, and you're not able to do that because you have to get what's called a prior authorization, or a PA. And I'm sure you've heard of this, and it drives you crazy. As doctors, it drives us crazy because we have to go in and do something extra so that we can say this person really needs this medicine, or this CT scan, or this MRI. All right. If you are denied, right, and you do not get the PA, please ask your doctor to do what's called a peer-to-peer. Most people don't realize you can do this. So basically that means your doctor has to call the insurance company and say, look, I need you to get this done or we're gonna have a problem, okay? And that's what I tend to do, and they say, okay, we'll do it. And it's like the squeaky wheel gets the grease. So if you have a really serious health issue and you need to get a very particular medicine and you were denied, and your doctor's office told you you were denied, have your doctor do a peer to peer, and that is a call. It takes extra time for the doctor, but it's
another
worth it
option.
because you need the situation to be handled.
Good to hear. We love, that little transparency there and something you
course.
can do when you feel like there's nothing else. Dr.
right.
Hebert joins us every Tuesday around this time, 6:45, to discuss some health news. And to rewatch this segment, we have it posted on our morning show page on our website, www.tv.com. Thanks for coming in.
Thank you.